We've discussed the cosmetic applications of laser therapy. Here to talk about the medical applications is Dr. Fred Kahn of the Meditech Laser Rehabilitation Clinic. Dr. Kahn has been involved with the development of laser technology in Canada. Welcome, and welcome to you, Matt. You work with Dr. Kahn?
Yes, I do.
So let's first talk about the medical applications. Where are you using laser in your practice?
We use it primarily for musculoskeletal problems, but also wound healing, burns, etc.
Now, when you're using this, the technology behind laser, we've just looked at laser for cosmetic and how it works on different wavelengths. Does this do the same type of thing?
Not dissimilar, but our wavelengths are more specific for the type of problems that we treat, which include everything from spinal problems, degenerative osteoarthritis, herniated discs, a variety of problems, including spinal stenosis.
So really, you're the athlete's friend more than anything else.
Well, athletes, people with arthritis, and all the other general musculoskeletal problems that we see, such as carpal tunnel syndrome, rotator cuff injuries, tennis elbow, and so forth.
Well, it sounds like it's endless. Matt, you're standing in front of two different devices. What are these devices?
Right. These, Dr. Shapiro, aren't actually laser devices. They're superluminous diodes, so they're high-intensity monochromatic light. They differ from laser in just that they're divergent light sources, so they do spread out more. But when I apply this to, actually, if I can borrow you for a moment.
Okay, he's going to borrow me. Should I let him do this, Dr. Kahn?
Absolutely.
Okay.
Totally safe.
We'll give you, for example, you have carpal tunnel syndrome and you were to come to our clinic.
Right.
And just go rotate your arm over. What I'm
Right.
going to do is just fasten this around. You can see it's a large surface head with multiple arrays on it. Okay. Just going to fasten it around your wrist. Very common procedure.
So it's just a device that I would wear around my wrist, and then what happens when you turn it on?
Well, when I double-click it to activate it, it would turn on a certain pulsation of light that we would prescribe into the system for you. So different conditions require different customizations of the light output. So to get, depending on depth of penetration, on the amount of inflammation that comes with it. So you can see, actually, I've changed the light output every 15 seconds.
So now it's constant.
Exactly.
Dr. Kahn, how many treatments would the average person need? I'm sure it depends on the severity of the injury, but your average carpal tunnel syndrome, let's say.
The average carpal tunnel syndrome would probably require about 8 to 10 treatments.
And each of those treatments lasts how long?
The treatment for carpal tunnel is usually about a half an hour.
Now, I felt absolutely nothing. Is there ever any discomfort associated with this?
There's never any real discomfort. Occasionally, people feel a slight degree of warmth, but other than that, no particular problem.
Now, the other device that you've brought, what is this, Dr. Kahn?
This is a prescription unit. If people come from a long way away,
You would send me home with this?
we would do a diagnosis or establish a diagnosis and establish protocols, download those onto the main controller, and then the patient can treat themselves at home on a daily or 3-4 times a week basis.
Right. Now, this also is emitting red light. Doesn't seem as strong or as bright as the other one was. So what would this be used for?
This would be used for the same things, but it doesn't have the laser diode, which we don't have here. But this delivers infrared light. These diodes are infrared, and they're quite powerful. The red diodes are only on to show you that the infrared diodes are emitting light.
And this is penetrating into the soft tissue and into the muscles and dealing with the inflammation.
Exactly. The red is fairly superficial, the infrared goes to a deeper level, and the laser diode goes to the deepest level.
Now, I know we always talk about education as being so important to help patients with compliance, and you've brought something to really show us how you can elucidate to the patient what they've got and how they can improve it. So walk me through the program that you have here and when you would use it. Is this a page of introductory? What are we looking at here?
We're looking at a picture of a wrist, anatomical demonstration, and a cross-section of the wrist to demonstrate carpal tunnel syndrome. And it shows inflammation of the median nerve with the attendant symptomatology and physical findings concurrent with that.
So it would really help the patient to understand what you're aiming to treat. Now, is there ever a time where laser is not indicated, a time where you shouldn't be doing laser?
The only contraindication that I'm aware of, contrary to what you may read in the literature periodically, is the first trimester of pregnancy.
And that's about it.
That's about it.
Well, thank you so much. New technology for common problems.